Every few years, the government of Nunavut receives information about the high rates of respiratory illness among children. The department vows to study the issue, but the rates stay high. This week, a new study revealed Nunavut has the highest rate of respiratory illness among children anywhere in the world, with overcrowding and secondhand smoke receiving most of the blame. We wanted to know, what is the department going to do? Their answer, a program of identifying the children at high risk.
And we've made changes every year to the eligibility criteria for children to be included in the program. We're still following the Canadian Pediatric Society and the National Advisory Committee on Immunizations position statements. We are well aware and extremely concerned about the high rates of RSV and other respiratory illnesses that we see in our young kids up here.
If that sounds familiar, it should. That is basically the same response the department gave in 2011 when they received the same information from the same doctor, Dr. Anna Banjiri, a respiratory illness specialist. The health minister brushed the study aside as the work of one researcher and called a proposed vaccine complex. In 2008, the government tried to stop Dr. Banjiri's research, despite support from Inuit organizations and the Nunavut Research Institute.
And I think one of the challenges with Dr. Banerjee's report is that she's using data from 2009 and earlier. So with the number of changes that we've made over the last few years, I think it's important for us to pause and reevaluate, looking at the similar criteria that she evaluated and just using our more up-to-date numbers.
There is one thing different this year: whooping cough. There are more than 100 cases of whooping cough in Nunavut so far this year, also known as pertussis. One respiratory illness combined with another can be lethal.
And if the co-infection can make them more severely unwell. So we're really encouraging healthcare providers to make sure that they've got all of their infants up to date with their pertussis vaccine, as well as making sure that we're encouraging people to practice good hand hygiene, to reduce the exposure to secondhand smoke for these children, and to make sure that the healthcare providers, are well versed in how to manage them.
The latest study recommends a drug to immunize children against respiratory illness. Northern Quebec will be using it. Nunavut hasn't decided yet, despite having the same option presented back in 2011 and 2009. The drug costs almost $7,000 a patient. A working group has been formed to discuss treating respiratory illness in Nunavut and will consider the drug. Will history repeat? Or can Nunavut finally make headway on a serious issue? Kent Driscoll, APTN National News, Iqaluit.